So I think all of you have completed the antenatal care of the MCH chapter, right? So today we'll be looking into intranatal care. Okay, so what is defined as management and delivery of care to women in labor. Okay, so now, so when a woman is in, going to be is pregnant and who is going to be delivered, so basically when you look into the rural and village areas where there is no healthcare facilities nearby, and to travel it takes a longer duration, so most of them opt to do no home deliveries. So that's where this main points comes into place. So so the most of the deliveries are done in the rural areas by dyes. Okay, these dyes you would heard of, now they are trained. So now what are the main five features which things which they have to take care while doing a delivery is that five cleans. First, keep clean hand and fingernails, clean surfaces, clean blades, clean cord tie, there's a tying of the cord, and clean umbilical stump. Okay, so what is clean umbilical stumps? In the rural areas there is also a custom where they put a cow dung onto the stump. So to prevent all these things we need to be completely clean. Now the guys are trained to do this. Okay, right, so that's in the during the delivery process. So the aim of this good intranatal care is mainly to prevent any infections, that is through asepsis. Okay, and delivery with minimum injury to the infant and mother, so that there is we have healthy baby and mother. Readiness to deal with complication has to be also be trained to this diaries has been trained. And what are those? If there is any prolonged labor, APH is antepartum hemorrhage, if there is any convulsion, malpresentations, prolapse of the cords, has to be able to manage or at least identify and refer to the higher centers. Coming to the next is, once you do a clean delivery and also handle with the complications, next is care of the baby at the delivery. So as soon as the baby comes out, there may be some secretions stuck in the nose or in the throat, so it has to be removed. And if the baby is not what is breathing, you need to resuscitation. And also the cord, umbilical cord, has to be taken care of, both the eyes, because it will be meconium stain or the amniotic fluid will be covering the eyes. Care of the eyes, care of the skin. Apgar score is the score of the baby related to the liveliness, so don't worry on that much now. So maintenance of baby body temperature has to be done, and as soon as baby is born, as early as possible, the baby has to be given to the mother to be breastfed. Okay, we'll be looking at that in more detail later. Coming to delivery kit. So this midwifery kit, or also called as DICE, what they normally the government is giving them the kits so that they can use the clean methods to do the delivery. So first thing is sterilized gloves and drapes are given, towels, cleaning materials, sterilizing equipment. So all these are given. So next is disposable delivery kit, that is sterile cord ties, blades, spirits, and injections has to be given to them so that they can do a safe delivery. So coming to, as you all I think would have studied the normal labor, that they have four stages, as you know. Stage 1, onset of the true labor pain to cervical dilatation. Stage 2, full cervical dilatation to delivery of the uterus. Stage 3, after delivery of the fetus to placental delivery. Stage 4, placental delivery to 1 hour after delivery. And these are the 4 stages of normal labor. Coming to domiciliary care, that is at home. Mother with normal obstetric history may be advised to have their confinement in their own home, providing the home condition are satisfactory. That is one. And now, as I told, these are conducted by health worker female or trained DICE. The health worker female trained to recognize the danger signs and referrals as we discussed earlier. So now domiciliary care is also becomes more fancier, where most of the high profile people are planning to do their delivery at home. There's something called as water delivery. So a lot of new things have come across in terms of deliveries, right? So coming to first main thing is which you have to understand for anyone who's doing delivery is just to find identify danger signs so that you can refer to the higher center or call for help. Okay, what are the danger signs? Sluggish pain or no pain after rupture of the membrane, pain for an hour after rupture of membrane, no progress, prolapse of the cord, meconium stained liquor. Meconium is the fetus fecal matter, right? Initial fecal matter is called as meconium. So meconium stained liquor or irregular or excessive fetal heart rate, as you know, excessive bleeding during labor. All this could be a danger sign, and either you have to call for help or refer to the higher center as early as possible. And also, there is collapse during labor. Of course, a placenta not separated within half an hour after delivery leads to postpartum hemorrhage, high risk of it, and infections, sepsis, right? So, postpartum hemorrhage or collapse can happen. A temperature of 38 degrees or over during the labor may be leading to sepsis again. So, all this could be danger signs. Okay, so but apart from all these things, if the mother is normal without any pre-existing diseases or conditions, then what is the advantage of doing an home delivery, domiciliary care? Delivery in the familiar condition at home, chance for cross infection and fewer than in hospital, so you don't get any other infected patients in the hospital which may get transmitted to you, is not there. Mother is able to keep an eye upon her children and domestic affairs with this may tend to ease her tension. So if they have already have one kid and household works, all this keeps continuing if at all you do at home. So that's one of the advantage. Sorry. Right. So coming to disadvantage of domiciliary care. Okay, the mother may have less medical and nursing supervision than in hospital. The mother may have less rest. She may resume her duties too soon, and her diet may be neglected because she is working and may not be taken care completely. Coming to institutional care, about 1% delivery tend to be abnormal and 4% difficult and requiring the services of doctor. That's it. It's recommended for all high risk cases, as you heard seen in the antenatal care, however, high risk pregnancy, right? So, high risk cases are anemia, heart disease, eclampsia, short stature, diabetes, jaundice, TB, oligohydramnios, malpresentations. All these are high risk cases, and then we do recommend them for institutional level, that's in 1 to 4% of cases. Coming to rooming in, what is that? Keeping the baby's crib by the side of the mother's bed. That is, always keep the baby very near, close to the mother. Opportunity. So what it gives by doing rooming in? It gives an opportunity for the mother to know her baby. Chance of breastfeeding is more because you are close to the kid. Confidence that her baby is not misplaced. So she wants to know that her kid is with her itself. So coming to what is called as obstetric emergencies, these conditions need referral. So even the DAI is trained to handle complications, but there are some things which has to be referred to the higher centers when you identify. So what are those? One, postpartum hemorrhage. What is that? More than 500 ml of blood loss if it is there, and increased pulse rate, decreased BP, refer. Sepsis, infection of reproductive organs leading to infertility and pelvic inflammatory disease (PID) leads to sepsis. Also refer. So it may be because of that not following the 5 clean strategies and prolonged labor, complication during delivery. All this could be there. Next is obstructed and prolonged labor. Okay, so again, if it is obstructed, maybe cephalopelvic disproportion, CPD, abnormal presentations, congenital abnormalities, all also has to be referred. Next is ruptured uterus in obstructed labor. Again, a lot of this. If there's a ruptured uterus, refer. Retained placenta, refer. Right. Okay, so that's where we completed intranatal care. So once you are taken care of all, like both mother, during the delivery with all the cleans, and post delivery the infant, and looking after the location where it has to be delivery, and also understanding the danger signs and when to refer, what are the conditions which you have to know to refer. Okay, with all those things. Now what has to be done after the baby is delivered and in the during that period of postnatal. First thing is, what is it? So postnatal care means systematic examination of the puerperal woman and her infants and advices given to them, included under the child. Okay, this is the program. Okay, under essential obstetrics care of RCH, reproductive child health, there is provision of 3 postnatal checkups. After the delivery there are 3 checkups to monitor postnatal recovery and also detect if any complications are there. So what is the need of the hour? Why we are doing this postnatal care? Once baby and mother is fine after discharge from the hospital, what has to be worried on? So incidence of postnatal complications are 42%. It's a huge number, right? Maternal mortality rate, okay, there are around 407 per 1 lakh live births. People die, pregnant women die. Okay, 400 is a big number. So AP, Andhra Pradesh, okay. Of these, 9% are due to antenatal postnatal hemorrhage, 16% due to puerperal sepsis. So there is a huge number of deaths which is happening just where with a lot of complications during the postnatal period, which are preventable cause of maternal deaths, and that's where it becomes very important. So now, what is the objective of doing this postnatal care? Prevent complications of postpartum period. One is complication. Second is rapid restoration of optimum health of mother. Okay, check adequacy of breastfeeding, provide family planning services, inform about immunization schedule, very important, note the progress of the baby, provide basic health education. So this becomes the objectives of the postnatal care. So what is puerperium? Puerperium is the postpartum 6 weeks period during which the maternal system, especially the pelvic organs, more or less return to the pre-gravid state. Before the pregnancy, how was the pelvic organs? That's the time it takes around 6 weeks to come back to that normal change. So what are the changes during pregnancy, puerperium, which happens normally? Physiologically, there is a changes in terms of pulse rate. There is increased pulse rate, temperature, constipation, and diuresis may happen. Weight loss could be there. Uterine changes, total involution by 6 weeks, completely come back to the normal. Regression of the vessels which were thick and big becomes very smaller now. Change in cervix and lower uterine segment. Cervical os narrows by end of first week. These are all anatomical changes. Does not assume pre-gravid state. Lower uterine segment regresses. So I would think it's trying to become normal. After pains, that is in multiparous woman, vigorous contraction of the uterus requires an analgesics and becomes mild by third postpartum day. That is because of the uterus keeps contracting, there may be some pain which may be found, and it has to be taken care with analgesics, and by third postpartum day it becomes mild. Okay, starting it will be more, because to remove any retained blood clots or any materials in the uterus, it keeps contracting. So next important topic is lochia. Okay, so now what is lochia? Physiological postpartum uterine discharge of mainly blood and necrotic dua during the first 3 to 4 weeks of puerperium is located. This is a very important point. So next is breast changes. So there is hypertrophy of breast tissue. Colostrum secretion is for 2 to 3 days following childbirth. Actual milk secretion from 3rd or 4th day. Milk secretion continues throughout puerperium and thereafter. Now coming to how you have to examination of the mother and infant. First is routine checkup, that is twice a day during first 3 days and once a day until umbilical cord drops off, and end of puerperium period, that's after 6 weeks. Okay, so the health worker female examination the mother for what are they examine for, either at home or at the hospital. First, they look for weight and temperature, blood pressure, pulse, respiratory rate, general health, signs of anemia, breast and lactation, tone of abdomen muscles and ppm, pelvic flows, record any complication if it is present, and uterine and adrenal structures, how it is, and are they are coming back to normal states. These are all the things which they examine. So what they examine for in infants, first is record weight, feed and progress of the infants, give immunization, very important, refer to a pediatrician for further care when it's required. So further visits, once they discharge from the hospital, once a month during the first 6 months, and once in 2 to 3 months till the end of the year he'd have to visit. Okay, the functions of female health worker, which we discussed, right? The female health worker present at the sub center, normally she is at the sub centers, limits her activities among 300 to 500 families. Okay, she registers pregnant mothers, gives advice on nutrition or nursing mothers, and provide at least 3 post-delivery visits after delivery is done. So she also distributes iron and folic acid tablets, spread the message of family planning, advice regarding immunization of infants, assess the growth and development of the infants, refers high-risk cases to first referral units or district hospitals, educate mothers in better family health, advice given to the okay, so now what is the advice given to the mother, right? So first thing is rest for about 8 to 12 hours has to be done. Then return to normal activity should be restricted for at least 2 to 3 weeks rest. Fully balanced diet with adequate calories, proteins, plenty of fluids, minerals and vitamins has to be given. Care of the perineal stitches when there is like doing some stitches in the pregnancy, delivery. Visitors to be restricted, especially if those suffering from some common cold or again now it is corona. So okay, something like that. Postpartum postures and exercise becomes very important to get back to the normal state. Feed the baby in sitting position, deep breathing, simple movement of limbs, simple exercise to strengthen abdominal muscles and pelvic flow has to be done. So postpartum psychosis, psychological fear born out of ignorance and insecurity regarding the baby is where becomes something called as postpartum psychosis. Okay, so how to overcome by the support and companionship of her husband and family, because baby is like crying, drinking food, drink, so it becomes very irritable for mother because she doesn't get sleep, she is tired, she is exhausted, so she becomes very tired, and becomes there's a fear also which becomes born, ignorance, insecurities, it all becomes something called as postpartum psychosis, right? So by proper health education to the mother with this can happen, this could be prevented, and also support from the husband. Care of the breast, rooming in is to be practiced, as we discussed, rooming in. Training for contraceptive usages has to be done. Health education regarding asepsis and antiseptics has to be done. Next important thing is breastfeeding. It is the first food to the infant. Every year August 1 to 7th is considered as the breastfeeding week. Okay, so breastfeeding can be started 30 minutes after birth, so that is as early as possible, and around 30 minutes it may take because delivery. Okay, so coming to statistics, okay, let's go with it. An average Indian mother feeds her infant around 2 years, for up to 2 years. Okay, secretes about 450 to 600 ml per day. Energy value is 70 calories per 100 ml. Protein content is 1.1 gram per 100 ml. So percentage of children who are exclusively breastfed is 37%. Intervals between feeding may vary from 1 to 4 hours. But important of all these points is, first is exclusive breastfeeding. The breastfeeding should be very exclusive for first 6 months as by the WHO. So now the thing is, what is the advantage of breastfeeding? Safe, clean, hygienic, cheap, and available at the right temperature, and it's a complete food. antimicrobial factors which is present, easily digestible, promotes bonding, sucking, develops a amount of joint teeth, protects from obesity, prevents malnutrition, biochemical advantages, helps in spacing between children. So all this becomes very advantageous. So after 4 months, weaning, not 4 months, now it is 6 months. So after 6 months, weaning food rich in proteins and other nutrients like animals milk, soft cooked and mashed vegetables etc has to be started. Avoid bottle feeding, that is nutritionally poor, bacteriologically dangerous. Indication of artificial feeding only when there is failure of breast milk, HIV positive mother or death of the mother. If not, it has to be completely avoided. Coming to family planning becomes one of the key part of the postpartum. That is, postpartum sterilization recommended on the second day of delivery. Intrauterine devices and conventional contraceptive during the first 6 months has to be practiced. Combined and sequential oral pills to be avoided. Following 6 months of breastfeeding, OCP pills or ICD can be given. Presently, the contraceptive prevalence is 47% in India. My God, okay. Right? So then you have to practice something called as small family normal. Do, hamare do was the thing which was practiced before. So objective is for something is symbolized by the inverted red triangle. As you can see, every postnatal woman is educated about this small family norm. Okay, right. So with that, we completed the intranatal and postnatal care of mother and child. Hope you stay safe at home. Take care. See you in the next class. Hopefully next class, yeah, I think next class again is online itself. Hopefully meet you soon for a virtual class, right? Thank you. Have a good day. Bye.